pulp cavity generally corresponds to the external contour of the tooth. All right. And the anatomy of the cusp can even be used to determine the height and contours of the pulp horns, as we mentioned earlier, especially in the posterior teeth. So let's see here. So permanent teeth pulp horns, all permanent incisors contain 3 pulp horns, as we saw. So they have, all permanent incisors have 3 pulp horns, except for the maxillary lateral incisor, which may have between 1 and 3. And the canines do not have pulp horns as such, but the pointed incisor limit of the pulp cavity does correspond to the single cusp. So there are no cusp horns in the canines. So pulp horns in both maxillary premolars. Okay, so both maxillary premolars have 2 pulp horns. The mandibular first premolar normally has 2 pulp horns, but the lingual pulp horn may be absent. Okay. Whenever something may be absent, keep that in mind. And the white type mandibular second premolar, we have 3 pulp horns, and the H type and the U type have 2 pulp horns. So the permanent molars normally have 4 pulp horns, okay, in each. So the anterior teeth usually have 3 pulp horns, except for the maxillary lateral incisor, which may have 1 to 3, and the posterior teeth generally have 4 pulp horns. On a newly erupted mandibular first molar, there may be 5 pulp horns. Okay. Now, the pulp canals of the anterior teeth. The permanent anterior teeth normally contains 1 pulp canal. About 2% of the time, a mandibular incisor may have 2 roots, okay, and 2 root canals. You actually, not 2 roots. The mandibular incisor may have 2 root canals. That's actually common. And about 6% of the time, mandibular canine may have 2 root canals. And the mandibular canines are the ones which are more likely to have 2 roots. Okay. So maxillary central incisor, this is a mid-root section, cross section. So a cross section of the root of maxillary central incisor is somewhat triangular in the cervical and middle root section. So in the incisor view, you can also see that there's a triangular shape. Okay. Maxillary central incisor, the mesiodistal cross section. This is a drawing, okay, which represents the pulp cavity of the maxillary central incisor on a young patient. You can see 3 pulp horns there. Mandibular central incisor cross section. So you have the mesial and distal root concavities are present, okay, here and here, and the root is thin mesiodistally, okay. All right. So maxillary first premolar mid root cross section. So they have a single root. At the mid root cross section. So single root, the mid root cross section is often referred to as kidney shaped, and the root concavity is on the mesial surface. However, remember that maxillary premolars, they have bifurcation of the root, so they may have two roots after bifurcation. But the mid root cross section is going to show one root and two canals. Maxillary first premolar mid root cross section. So this is the mid root cross section of the maxillary first premolar. It is with a laminated root. Okay, so meaning you see two layers here. All right, so that's called laminated. All right, and the deepest concavity is the mesial surface. So the concavity of the mesial aspect of the root is very prominent. Maxillary first premolar may have three roots. Okay, a small second buccal root is located to the distal. So maxillary first